Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Product Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our genetics series, a special collaboration between the Blum Center and the Center for Genomic Medicine at Mass General. Before we get started, I want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has been muted so you can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all to today's guest speaker. Joining us today, we have Courtney Gwynne. Courtney is a licensed and certified genetic counselor in the cardiovascular genetics program. She sees patients who have problems with their heart muscle, the electrical system of their heart, and their aortas. She recently graduated with her master's degree in genetic counseling from Columbia University in 2023. Prior to finishing genetic counseling school, Courtney worked here at MGH for 4 years as a clinical research coordinator in cardiology and genetic counseling assistant in the Center for Genomic Medicine, where she assisted efforts in the preventive, cardiovascular, renal, and medical genetics programs. She joins us today to give a talk on genetics and testing, why knowing family history is important, and how genes in the environment can work together to cause disease. So please join me in welcoming Courtney.
Thank you, Amy. All right, I will share my screen, get everything set up. All right, everything look okay? Perfect. All right, so as Amy was saying, we'll be talking about genes, family trees, and complex disease. And I know Amy gave a lovely introduction, but I wanted to talk a little bit about who I am and what a genetic counselor is. So a genetic counselor is a trained medical professional who gathers information about you and your family, talks about your risk for a genetic condition, can help select a test that is right for you if appropriate, and guide you through results and how they may impact your life and your family. We work across a range of specialties, so I'm in cardiology, but there's also genetic counselors in specialties like cancer, pediatrics, metabolics, things for your kidneys and your eyes, and we're expanding to other specialties as well. We work with doctors as well as independently, and we can see patients virtually, so through Zoom or in person, depending on the specific clinic. So our plan for today, so as a note, this will be an introduction, so we won't be going into too in-depth into all of these topics, but I will provide some resources to learn more and just give a general introduction. So we'll talk about genes and how they work, complex disease, so how genes in the environment can work together to cause disease. We'll talk about family history and why it's important and how to gather it. And we'll talk about genetic testing and what it can tell us. So first, I'll talk a little bit about genes. So genes are the instructions that tell our bodies how to grow and function. And you can think of our genome, so all our genetic information, as a recipe book. Our genetic code or recipe book is filled with DNA, which is made up of many letters. Instead of using all 26 letters like our English alphabet, our DNA uses 4 letters, so A, T, C, and G. And depending on the different combinations of these letters, this has different results in the proteins in our body and therefore, how our bodies grow and function. For context, just as for scale, we have 3 billion pairs of these letters. And so it's a pretty large recipe book to fill in all of those letters. So I know we talked about a recipe book, so I wanted to think about what are the important parts of a recipe to kind of explain genes and how they work. So what are the important parts of a recipe? So you might say ingredients, the amount, so how much of each ingredient, the order that we make the recipe, the timing, so 20 minutes versus 2 hours has a difference, and method. So depending on how something is cooked, oven versus toaster versus microwave, it's going to come out a little different. What happens if there is a mistake in the recipe's ingredients? Oh, what is going on? 1 second. Can you see this? Okay, perfect. So thinking about the ingredients, what would happen if there's a mistake in the recipe? So what if we were making cookies, but instead of 1 cup of sugar, the recipe had a typo or a spelling mistake, and there was instead 1 cup of salt? So the cookies would probably be really salty. They wouldn't come out how we might expect. And just like in a recipe, this can happen in our genes as well. So there can be spelling changes in the letters of our DNA. And these changes can affect how our bodies grow and function. So they might be a little different than we expect. Now, you may hear me say different words to describe this, but there are many different names for spelling mistakes. So a genetic change, a mutation, or a variant. And here's just a brief example of what our genetic code might look like and what might happen if there's a spelling mistake. So instead of having a G here, there could be a T here, and that might change the number of letters, a number of fingers that people have. There are other examples of genetic changes too, so it's not just spelling mistakes going from sugar to salt. You can also have something called a duplication, so more than the expected number of copies of a gene. In this case, multiple salts. And so the duplication can be maybe an extra letter, an extra part of the gene, a whole extra gene, or even larger than that. So if we're thinking about a recipe book, maybe an extra chapter or an extra whole recipe. On the other hand, you can also have a deletion. So this can also be of many different sizes, but generally it means that there's something missing. Now, some changes can make a big impact. So like how we said sugar being switched for salt in our cookies, that could be really noticeable. Our cookies could be really salty, but other changes can make a small impact. And so say we switched from 1 teaspoon of vanilla to 1 tablespoon of vanilla in our cookies, there wouldn't be really much of a noticeable difference. They're still cookies, they still taste good. And it's really just going from a teaspoon to a tablespoon. It won't completely change the recipe on its own, but maybe if there's multiple differences, it might make a change. So what would happen if there are a lot of changes to the recipe? So there's a little too much flour, not enough eggs, a little extra salt, not enough baking soda. Each one of these on its own might not make a huge difference in the recipe, but all of the changes together could completely change the recipe. You might try to make cookies and end up making bread or brownies. And this brings us to our concept of complex disease. So instead of just being simple, genetics, 1 gene, we're going to talk a little bit about the differences. So in our measuring cup here, if the cup is filled to the top, we'll say this leads to a disease or condition, or just a difference between people, like a trait. So when we're talking about those larger changes leading to a larger difference, so like salt for sugar, we can think of that as monogenic disease, so here in red. Changes in 1 gene, or mono meaning 1, can have a big effect and might be, noticeable. In other types of conditions, it may take a bunch of smaller genetic changes to show a meaningful difference. So here in blue, these are genes that have a smaller overall effect on our health individually, but when there's a bunch of them together, it can lead to a difference in our health or bodies. So poly meaning many versus mono meaning 1. And so as you can see, both of these cases, they can fill up the cup, the measuring cup, and lead to a disease or condition, but it takes a little bit extra of the polygenic. Here is another way to look at it. So I'm showing how common a genetic change or variant is on the horizontal axis here, and the effect of the body on the vertical axis. As you go right, it goes from very rare to more common. And as you go up, it goes from a small effect to a bigger effect. Monogenic diseases tend to be more rare. And now I don't necessarily mean something like 1 in a million, but if you walk into a random room, people might not all have these conditions. So an example, if you've heard of something called cystic fibrosis, sickle cell anemia, polycystic kidney disease, these are all monogenic disorders. On the other hand, some conditions take multiple genes to impact our bodies, so those polygenic genes. And these are much more common. So things like weight are controlled by many genes, many of which we don't know. And same with diabetes and coronary artery disease. So that's when there's blockages in the arteries from cholesterol buildup. And a lot of these are caused by many, many different small changes that by themselves have a very small effect. But like we said, if you have enough to fill the cup, you might see this condition. And you likely know many people with these concerns versus you might only know 1 or 2 with these concerns. And so when thinking about complex disease and really any disease, genes are not the only piece of the puzzle. So the ingredients aren't the only thing that matters in a recipe, just like genes aren't the only things that matters in our body. And so thinking like other factors, so how it was cooked, we talked about the differences between, an oven or a toaster. And how long? So how long were they exposed to this heat? How long was it cooked for? And so all of these things can impact our health. So other factors besides our genetics impact our bodies too. And like with baking, our environment matters. So, we think of cooking or baking with an oven, but we can think of our environment as the other things that impact our health. So things like where we grew up and whether we smoke or drink, what food we have access to, or how close to pollution we are. Also, if we have trauma, these things can all impact us. And it's important to note that many of these things are outside of our control. So what's in the water, how close we live to like a, nuclear plant or radiation, extremely stressful situations like war or other types of trauma. And so all of these can impact how our bodies work. And so it's not just our genes playing a role, there's also environment. And so again, not just things like weather, but other factors can work together and cause a disease or condition. So oftentimes it's not that there's just a bunch of genetic changes that are impacting our bodies, but actually genetic changes in blue and environmental factors in orange. But there can also be protective factors that help our measuring cup hold more. So while a lot of things are outside of our control, there are things that we can do to help. So things that help us, maybe like exercise, therapy, and medications can help our cup hold more. So, maybe the environmental factors and the genes are staying pretty much the same, but adding these positive things can mean we have a greater capacity to hold what we've accumulated. And so sometimes what that means is we might get this later. So say something like a certain type of cancer, we have some sort of genes impacting, and then environmental factors. Maybe it will take longer for it to accumulate and to cause cancer. Now, this isn't always the case. So there's not always something that we can do to, remove our risk completely. And sometimes it's a lot more difficult for people with these genetic changes to do these other protective factors, but we can certainly try. And so, we talked about genes, we talked about complex disease and the environment, we talked about things that we can't control and maybe some things we can do a little bit. But what does it have to do with you specifically? What can we do about that? How do you know if you're at risk for a genetic condition? How would you use this information? And so, like a family recipe, genetic information can be passed down through generations. So we can gather clues from our family history and tell us, what might we be at risk for. So this brings us to family history. What are the types of things that family history can tell us? So they can tell us what diseases are running in the family, what ages people were diagnosed, how something is being passed down or inherited, which we'll talk about more, who may be at risk for a disease or condition in your family. And depending on the condition, some people might be eligible for genetic testing, which we'll also talk about later. And so when you're trying to gather family history from your relatives, there's some information that can be really helpful. So ages of each family member can be important. Diagnoses, so are there people diagnosed with cancers or heart problems, hearing loss, kidney problems, really any problem you can write down. The age that they were diagnosed is really important. So looking at someone that was diagnosed with a cancer at 40 is a lot different than someone being diagnosed with a cancer at 80. There's a higher risk the older you get. The age that they passed away and how someone passed away can give us more information. Information like miscarriages and stillbirths can tell us information about our risk as well. And important surgeries, so things like organs being removed. So things like the uterus or ovaries or getting a mastectomy, so the breasts. Can also be things like transplants, so the heart or the kidneys. This is important information. And I think it's important to, when talking about this family history information and what might be helpful, is that not everybody knows this about their family. So even if you ask, you might not get the answers that you're asking. So I ask these family questions a lot. So every time I see a patient, I ask a lot of these questions. And most people don't know all of the answers. So whether they're adopted or not close with their family members, or a lot of people are really private about their medical information, or it was a stressful time and they honestly just don't remember. All of that's okay and is completely normal. So, I ask these questions of others. I couldn't tell you half the information about my own family, and I'm, very active in trying to get this information. So, any information that you can get can be really helpful. Getting things written down as you know them. Any info is good. It's okay if you don't know. Okay. And so when we're collecting a family history, genetic counselors generally put it on something called a pedigree. So this can be hand-drawn or electronically drawn. And this is an example of a pedigree I made. And basically what it is, it's a bunch of symbols and information that helps us gather, patterns in the family or red flags that might suggest something genetic. In here, so people that identify as female are represented as circles and males as squares. We also use diamonds when there is more than one person or someone's non-binary or their gender wasn't specified. And each line is a different generation. So this is our patient with the arrow here, the generation above. We have her grandparents and her children. And it can be helpful to have the age of diagnosis. So we have our patient here, she's currently 39, and she was diagnosed with a heart problem called hypertrophic cardiomyopathy at 32. Hypertrophic cardiomyopathy I use as an example, really just a big fancy word to say that there's a problem with the heart muscle. I work in cardiology, so I had to throw something in here. And so, these symbols can really give us a quick look into how things are being shown in patterns in the family, so as they get passed down. So when thinking about patterns and getting passed down, I wanted to talk a little bit about inheritance. So it's important to know that we actually have 2 copies of every gene, one from each parent. So our parents each give us a single copy of the gene, so they share 50% of their DNA with us. Since parents only pass down half of their DNA to us, only pass 1 copy of each gene, it's like a flip of a coin deciding which copy of each gene that we get. So there's a 50-50 chance of heads or tails. So 1 copy of the gene, the other copy of the gene. When someone says a condition is autosomal dominant, that means that we only need 1 abnormal copy of a gene to cause a condition. So if we have 2 copies of the gene, only one has to have a mutation or a genetic change in it to cause a condition. And so I have the flip of a coin here too. So it would be a flip of a coin whether you pass down the abnormal copy to your child or the normal copy to your child. And here's just a visual representation. So we have an affected parent here in dark blue, affected meaning that they have the condition. And then it's a 50-50 chance for each child. So flip of a coin, flip of a coin, flip of a coin, flip of a coin. And you'll see that in this example, they had 2 out of the 4 children be affected, so 50%. It doesn't always end up that it's a perfect half of your children because it resets for each child, but we would say each child has a 50% chance. Right. And I'm bringing you back to the pedigree that I had showed earlier. And so HCM is inherited in an autosomal dominant manner. So as you can see, our 39-year-old has a lot of relatives with the same condition as her. So she has a brother with HCM, a father with HCM, and a cousin with HCM. When we see an autosomal dominant condition, we don't expect it to skip generations. So we wouldn't expect, this person to inherit HCM without having the mom also have it. However, as you can see here, they died suddenly at a young age, and that could probably be related to HCM. And same with this grandparent over here. So the grandfather, he had an enlarged heart, which is code for HCM or another type of cardiomyopathy or muscle problem in the heart. And so that could tell us that it was probably coming from the grandfather here and was passed down to both the dad of our patient and the aunt of our patient. And as you can see, it's getting passed down here. Now, this isn't a perfect rule that it doesn't skip generations. Sometimes people can, not be diagnosed till really late in life. Some people might never have it. But here we just don't have any data for these kids because they haven't been checked yet, but it's possible they could develop it in the future. And ages of diagnosis can give us a little bit of information, but it's going to be different for each person. So, the daughter was diagnosed at 32, but the dad was diagnosed at 40. So it can really span, all different types of ages. On the other hand, there is inheritance called autosomal recessive inheritance. So because we have 2 copies of each gene with autosomal recessive inheritance, both copies need to be abnormal. So they both need to have a mutation in them to cause a condition. So here we have 2 parents that don't have a condition, and then they have 1 child with a condition. And we'll talk a little bit more about that. So generally, this means that both parents would need to pass down an abnormal copy to their child. So like 2 flips of a coin, instead of just being 1, 50-50, there would now be a 25% chance of their children to be affected because it's a flip of a coin for dad to pass it down, and it's a flip of a coin for mom to pass it down. So there would be a 25% chance of each child inheriting both copies. So both abnormal copies from their parents. Now, if we notice these parents aren't affected, so they're not in dark blue, they don't have the condition, they are what we call carriers. So this means that someone has 1 abnormal copy and 1 normal copy. And so carriers don't generally have any symptoms. There are, of course, exceptions to every rule, but generally carriers are completely healthy. They probably don't know they're carriers. And you can see that carriers are in light blue. Now, the only problem really is when people have children with other carriers, and then their kids can also be at risk. Being a carrier alone doesn't mean your child is going to have a disease. It just means that you're a carrier and you might want to gather more information. So here's an example of an autosomal recessive pedigree. So I still have a 39-year-old here, but I switched it up. So we're going to talk about cystic fibrosis or CF. And if we can see here, these dots mean that they're carriers. So if they're filled in, that means they have a condition. If it's not filled in, then they don't have a condition. And as you can see here, he had 1 abnormal copy and mom also had 1 abnormal copy. And the daughter inherited both abnormal copies because both of her copies are abnormal. You can see also that her cousin over here has CF as well because both of her parents are carriers. And it's important to know that, some families can have lots and lots of carriers of disease and never actually have a child with cystic fibrosis or another condition. It's really the luck of the draw and, who you're having children with. And sometimes we can just never have families that have CF, even if there are a lot of carriers. So, for example, I found out that I'm a carrier for cystic fibrosis, but I've never heard of anyone in my family for as long as I know that had cystic fibrosis. And so sometimes family history information for these types of conditions aren't really enough. And there can be genetic testing that we can offer prior to pregnancy that give us a little bit more information. All right, so I talked about a couple types of inheritance, so autosomal recessive and autosomal dominant. But there are other patterns of inheritance. So if you want to look more into these, you can look them up, but there's called X-linked recessive, X-linked dominant, and mitochondrial. But the ones that we talked about are the most common and what you might notice from a pedigree or family history. So you might be asking, okay, I want to gather all of this information, but how do we record this information? Well, first of all, you're welcome to just do it on a pen and paper. That's the easiest way to do it. But there's also some tools online that are free. So the Center for Disease Control actually has a free tool that you can use. It's all electronic and you can update it as you gather more information. You can share it with your family members. There'll be a link, and as well, you can feel free to scan this on your phone camera, or it's probably pretty easy to just Google CDC Family History Tool. But again, pen and paper works great. I use a pen and paper while I'm in clinic, and then I often update it on a different platform. Okay. So now once you do this, you've collected some family history from your family and you want to know, okay, but when should I see a genetic counselor? Like when should I be concerned? And so one thing we want to look out for is multiple family members with the same condition. So things like certain types of cancers. So do you have multiple family members with breast cancer or colon cancer? Do you have multiple family members with a heart problem? So like a problem with the muscle or cardiomyopathy, like I mentioned. It's important to get those diagnosis ages because when something's starting from birth or say under 50 years old, it might be more suspicious. So if someone comes in with hearing loss at 1 year old versus hearing loss at 80 years old, we'd be more concerned that it would be genetic at such a young age. If someone dies suddenly and it's unexplained, that can be suspicious, so especially at a young age as well. So we would want to gather more info from our family. Was someone there when they passed away? Was there an autopsy done? Is there any kind of clues that could tell us why they passed away? Or was it really sudden and we just don't know what happened? If we see people with multiple miscarriages or stillbirths, so miscarriages are very common, very, very common. But when we see 3 miscarriages in a row, that would be more concerning to us. So if people are having trouble getting pregnant, staying pregnant, or having children, this can be a genetic cause sometimes. And it's not just from the mother or pregnant person. A lot of times it can be also from the partner. If we see people in the family that have delays in development, so maybe a child that has trouble meeting their milestones like walking, talking, or things like that, intellectual disabilities or autism, this can also actually be due to a genetic condition. And so they can see a geneticist or genetic counselor and see if testing might be helpful. And one of the reasons that knowing this information can be really important is that people with a family history of certain conditions or genetic disorders are eligible for early screening. So, for example, when I talked about the condition HCM, people with a family history of HCM can get imaging of their hearts earlier. So most people don't just get an echocardiogram, which is an ultrasound of the heart, unless you have specific symptoms. But if you know that you have a family history of a heart condition, it can be helpful to look at it earlier and know if you also have that condition. Similarly, when people have a family history of colon cancer, they may need colonoscopies earlier than the general population. They might do it, 10 years earlier or closer to the age that their family member was diagnosed. And same with breast cancer. There might be different screenings that they can do based on their family history. So maybe doing mammograms earlier or a breast MRI or anything like that. And so while family history is really important, that can help us and we can say, okay, all brothers and sisters, all children, and all parents of this person can get screened. Genetic information can help us a lot more to narrow down who in the family is actually at risk and who needs to get these screenings. So I'll talk about genetic testing now. So what can genetic testing do? So genetic testing can diagnose a condition, so maybe one you didn't actually know you have, and it might unify all of the symptoms that you're having. It could give you more information about why something is happening. If you have HCM, for example, the heart problem, we're not going to diagnose HCM from this. We're going to say, okay, now we have an answer for you. It can also help your medical providers decide on treatment. So treatment doesn't always mean something like gene therapy. You might see gene therapy in the news or people saying you can edit your genome. That's not the case for the vast majority of conditions. It's really deciding, maybe there's a particular medication or therapy that would be helpful based on your genetic information. One of the main reasons that people like to get genetic testing, even if they know their diagnosis, is to get access to support resources and education. So you might know in general what's going on with your health, but when you find a specific diagnosis, you can really find a network of people. So people that can help you understand it more, or just other people to talk to with the things you're going through, because a lot of people might have the same, anxieties or concerns as you. This was the big one that I was talking about. So even if it doesn't impact you, it might impact your family members who need to be screened or tested for the condition. So instead of waiting for symptoms to happen or something like cancer to be diagnosed, it can be found earlier and treated sooner if they're able to get access to screening. So if someone was found to have a genetic test result that was positive, the family members could also be tested for that and find out that they actually do need to get those mammograms extra. Information can also be used for family planning decisions. So you can find out if you and your partner are carriers for the same disease and putting your children at risk. Some genetic test results can actually help you qualify for research studies. So say there's, a normal treatment that they have for everybody that has a certain condition, but then you find out to have a specific mutation or genetic cause. This can help us understand, maybe there's a clinical trial for a treatment that you may be eligible for, or even just ones that help you learn more about rare conditions. Now, if you look at the family history and it gives you information, it can be helpful to figure out who's the actual best person to get genetic testing. We all have a family history of something, and we're not all going to see a genetic counselor for that family history. So the best advice I have is that ideally the person with the condition is the best person to see a genetic counselor first. That can be really helpful because we're looking, at the source. If they're still living, we can see, what was actually causing it in them, and that makes it a lot more informative for family members. Most clinics, I would say, at least in cardiology, they won't generally offer genetic testing to family members without a known genetic cause in the family, because really it can be hard to interpret their results in a healthy person if we don't know what caused it in their family member. Other conditions like cancers and things like that, they will do testing for a family history if it's strong enough. Now, what happens if there are multiple living family members with a condition? So the relative who is diagnosed the youngest or is the most severely affected is best. So, if someone was diagnosed with breast cancer at 30, they're probably a better person to test than someone that was diagnosed at 70. Or what if someone has two types of cancer? So that would be probably the most severely affected. Or if someone with a heart condition, if one person has a heart condition and they needed a heart transplant, but their brother didn't need a heart transplant, the person with the transplant is probably the best person to test because it's the most likely to find a positive result and give us more information about the family members. And for genetic testing, so like I said before, people may just get genetic testing when they're completely healthy before planning to have children or during pregnancy. So even if they don't have a personal or family history of a condition, they might want to just learn more information before they decide to spread their family. All right. So in thinking of the types of genetic tests that we can look at, we can be really focused or really broad. So we can look at a specific mutation, so one little part of a gene. We can look at a whole gene specifically. We can look at what's called a panel of genes. So there might be panels that are related to a certain heart problem that people get when they're pregnant or for cancers. And so these are all genes that are known to be associated or related to a condition, and we just focus on those genes. Now, I couldn't fit 20,000 little rectangles in my slides, so I just wanted to put that here. So we have a lot of genes, so 20,000 protein coding genes. If we don't really know what the diagnosis could be, someone came in with a bunch of different issues, maybe they're a child with birth defects or intellectual disability, and we don't know, it's just a little too broad. We can't narrow down exactly what's going on with the family. We may want to look at a broad look. So this would look at 20,000 genes. There are other tests that look at bigger parts of our genome. So our DNA is located on something called a chromosome. And if we think about, in the context of a recipe book, that would be looking at the chapters of the book. So this would be zooming out. Instead of looking at the recipes or the ingredients, we'd be focusing on whether there's missing or extra chapters, or maybe rearranged chapters in the book. So for the genetic testing process, what do we do there? So what you would do, you could meet with a genetic counselor and a physician or a geneticist, and you can talk about the risk, benefits, and test selection, so what might be best for you, and sign a consent form that says that you agree to genetic testing. Not everyone that sees a genetic counselor or geneticist will get genetic testing, but this is the option. So then you could collect a sample. So traditionally it used to be all blood, but now we can do genetic testing with saliva and cheek swabs. Since the COVID-19 pandemic started, we've been doing a lot more virtual care. And so more people have been doing saliva because you can send the saliva kits right to their home. Then they send it back to the lab, and the lab will read the DNA. So if you remember all of those letters, look at the areas of interest, so which specific genes they wanted to look at, or all of the genes in some cases, and compare to a reference genome, so what we would expect to see. This isn't just one person's genetic information that they're comparing it to. It's what we would expect to be normal or, something that doesn't have a lot of mutations in it. And then testing can take as little as a week to come back or as long as 6 months, depending on what it's looking at, how much information they need to go through. But generally, after a period of time, the provider will get the results, review them, and communicate them with you based on, your personal history and how they interpret it with your personal history. So types of results. So a positive result is a genetic change found that causes a condition or disease. So they looked at the specific genes that they wanted to look at, perhaps. They found a genetic explanation for you, and now they know what they can look at in family members to see if they inherited it as well. A negative result, so that means no genetic changes were found that explain a condition or disease. So negative doesn't necessarily mean it's not genetic. It's possible that there's more genes that we don't know about yet that cause a disease, or there could be types of mutations or variants that our technology can't pick up every time at this time. Uncertain. So that means a genetic change was found, but there isn't enough evidence to say whether it causes a disease or not. So it's kind of like being stuck in limbo. So there's not enough evidence either way to say that it's positive or a negative result. And so these can change over time as more information is gathered. We might find out in 5 years that the uncertain genetic change doesn't impact health, so it's negative, or we might find out that it's positive 5 years down the line. But while we're in this uncertain bucket, we wouldn't really offer testing to family members because it wouldn't give us more information about family members' risk. And this is one of the reasons why it can be really difficult to do testing in people that don't have a personal history of disease. So someone that isn't affected by a condition, because when we get these uncertain results, we don't really know what to do with them. When it's in a person that has a condition, we can just keep treating them like they were treated because they already have a condition, and we can watch out for this. But if someone doesn't have a condition, this might cause extra anxiety because it's really uncertain. We don't know if this impacts your health at all. And so it's kind of being stuck. So it's important to note that not all genetic changes are harmful. So some changes don't actually make a difference in our bodies or health, so they're harmless. So I used this analogy here. So gray versus gray, it's both the color gray. It doesn't make a difference, and we all have mutations or variants in our bodies that don't actually do anything to our health. Generally, these aren't reported in a genetic test report since there are so many. I mean, we can have many mutations that don't actually mean anything. But you may be asking, if not all changes impact our health, how do we tell the difference between them? So, if we're getting all of these benign or harmless changes, how do we decide what is harmful and what's harmless? And so some information that scientists or clinicians, so your doctors might think about, or your genetic counselors might think about, is the type of mutation. So was it one of those spelling mistakes? Was it a deletion or a duplication? Is there a whole ingredient or gene missing? These are the types of things we can think about. We can also think about the size of the mutation. So again, is a whole chapter of the recipe book missing? Is just an ingredient missing? Things like that. The location. So sometimes there could be parts of the gene that we know have a lot of mutations that are disease causing, meaning that they cause a condition. While some other parts of the gene might have a lot of mutations that don't actually impact the health because that part of the gene may not be as important as other parts of the gene. And so when we look at a mutation, we might want to see, where is it in the gene? Where is it in our genome? And compare that to, other data. There could be actual research studies on function. So they might look at these mutations in something like mice or in cells and see how it impacts the protein and how it impacts the animal. They might have research studies where they've tried to compare between healthy people versus people with certain diseases. So maybe there were 100 people with hypertrophic cardiomyopathy and 100 people without hypertrophic cardiomyopathy, and this mutation was seen in all of the healthy people. If we see the mutation in a bunch of healthy people, we wouldn't expect it to cause hypertrophic cardiomyopathy. There are also fancy algorithms that can predict how the genetic change affects the proteins in the body. So instead of looking directly in a mouse, in a cell, they can use computer algorithms, so fancy predictions that can tell us, based on previous evidence, whether it affects the body or not. But our knowledge is always growing and evolving. So like I was saying, we know much more than we knew 10, 5, even 5 years ago, even 2 years ago. And really, who knows what we'll know 10 years from now. So everything that we talked about could be in flux as we learn more information. And I know we went, briefly through all these topics, so I wanted to give more resources in case you want to learn a little bit more about genetics, just because this was more of an intro. So the cdc.gov is really helpful. This is the Mass General Hospital resource for genetics and genomics. So this is something that has information generally about genetics, but also it goes through all of the different genetics departments at Mass General and Brigham and Women's. And so, if you're doing your family history collection and you find out, multiple people in my family have a certain type of condition, you can take a look at this and see if there might be a clinic that's for you. There is also a website called findageneticcounselor.org. You can either have the NSGC or not. And that can help you identify genetic counselors in your area that, specifically look at the condition that you're interested in. This can be all over the country, and you can filter it by, virtual care versus in-person care, which specialty they are. So is it cardiology or cancer? And so that can be really helpful. Medline Plus is also a really helpful tool. It breaks things down pretty nicely and has links to more information if you need it. But you could type in a gene or a condition and they probably have a page about it. This nccn.org is all about cancers. So if you have a family history or personal history of cancer and you want to see the patient guidelines for screening, that can tell you, who may be eligible for extra screening in your family, who may be eligible for genetic testing. Facing Our Risk is another resource that's specifically for people with cancers or family history of cancer. A lot of times it's people with BRCA1 or 2 mutations. So if you've heard of BRCA. And then I also put this here. So it's called SADS.org. That's for people with genetic heart problems. And I also wanted to highlight some other options through the center here. So there's some upcoming talks for the genetics talks, as well as some previous talks. So coming up, we have some colleagues talking about pharmacogenomics, which is how medicines interact with our genes, things about dementia and Alzheimer's. So we have a talk about that. Another colleague is talking about carrier screening recommendations. So when I was talking about pregnancy and family planning. And then if you've ever heard of Ehlers-Danlos syndrome, so Dr. Sweetser will talk about what parts are genetic, what types are not, and different things like that. And then I talked a lot about cancer, but I'm not a cancer genetic counselor, but there are tons on the YouTube channel, Blum website from the Cancer Genetics Special. And then if you're someone that has had, 23andMe or Ancestry DNA or something that you bought online and you want to learn more about, what that was actually looking at and how it compares to clinical genetic testing, there's also a talk about that. I would definitely recommend checking that out. And then that's all I had. So thank you, and I'm happy to take questions.
Thank you so much, Courtney. We're now at the end of the session. If you have any questions for Courtney, feel free to enter them in the chat. We have a question regarding genetic testing and genetic counseling. Do you always perform genetic testing along with genetic counseling, or are you able to provide genetic counseling without genetic testing?
That's a great question. So you can have genetic counseling without genetic testing. So we're happy to talk to you about your risk. Not everyone that comes to see us will decide to get genetic testing, and not everyone that sees us will be, recommended to have genetic testing either. Sometimes people come in and there's not really a high risk, or they just don't think it would help them. There's many reasons why people might not want the information. So it's definitely not like something like, oh, I only, I have to get genetic testing if I go see a genetic counselor.
Thank you. And in general, does insurance cover genetic testing and or genetic counseling?
That is a great question. So I think we're always fighting with with insurance companies. I'd say the professional guidelines, so from, the professional companies, so things like the American Heart Association or different cancer associations do agree that genetic testing would be helpful for the patient. Sometimes it can take many years for insurance companies to catch up with these guidelines. Some labs will give like an estimate. So they might look and see if it's covered by insurance and give you an estimate out of pocket cost. And certain types of insurance, they won't get any cost. So if in certain labs, if they have Medicaid or Medicare, they won't receive a bill. But it is very individual depending on the type of insurance and the type of test. But genetic counselors actually can help you with, trying to figure out if it would be covered or not.
Thank you. And what are your thoughts on home genetic test kits? Ones that aren't ordered by a genetic counselor, like for instance, 23andMe.
Mm-hmm. I think to go more in depth, maybe watch the the Blum video, but for a quick question here, I think it's important to know the risks and benefits. I think sometimes going online and not going through a clinician can be a little bit misleading. So for example, if you had a family history of cancer and you wanted to learn more about your breast cancer risk and you went through 23andMe and they said, nope, you don't have a BRCA1 or 2 mutation, that's actually some false reassurance. So something like 23andMe is only looking at those specific parts of the gene. They're not looking at the whole gene. And so sometimes, especially in different ancestral backgrounds, they might only be looking at certain mutations associated with Europeans. And then people are missing, a whole subtype of mutations that they're not actually looking at. So clinician would look at the whole gene versus direct to consumer might just look at little parts and be a little bit misleading.
Thank you. You had discussed earlier on the benefits of collecting our family history. How far back a generation should we go in collecting our family history?
Sure. So I generally recommend going to your grandparents. So 2 degrees of removal, so 2 extra generations going up and down.
Thank you. And you have provided wonderful resources at the end, as well as the CDC family history link. So anyone who's interested in receiving those resources, feel free to email the Blum Center at pflc@partners.org, and I'd be happy to share that with you all. I'll also enter in the chat. So while we wait to see if there are any final questions, are there any final thoughts you'd like to share with the audience, Courtney?
Sure. I think it's important to realize that not everybody knows all of this information. And so it can be really helpful to try to get the information about your family history, but it may be a little difficult talking to your family members about these things. But I guess don't be afraid to try to contact a genetic counselor and see, what might be helpful for you. But I think really it's just, being gentle with yourself and trying to learn little bits at a time because it is a lot of information.
Thank you, Courtney. I think that's it for questions. It'd be fine to end a few minutes early. Thank you so much, everyone, for taking the time to join us. Hopefully you found it helpful. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you, everybody.